Hi there. Welcome back to Life Reconsidered with your girl, Dr. T. Today we want to look at a neurodevelopmental disorder, which is commonly diagnosed among children between the ages 4 years old to 16 years old. However, this same disorder can be diagnosed among adults, especially those adults who had challenges and symptoms when they were younger, and those symptoms were misdiagnosed or were not even identified as challenges when they were growing up. Today, we are looking at attention deficit hyperactive disorder, ADHD for short. What is ADHD? There are two main predominant type of ADHD and a third type which is a combination of these two predominant types. The first one that we want to look at is the inattentive deficit disorder, ADD for short. Now, children who have challenges with inattentiveness finds it difficulty to listen to teachers. They find it difficult to listen to even parents or peers or adults in the society. But particularly when this is happening a lot in school, it can affect the child's performance. Another characteristic that we find is that children who are inattentive are very distracted by things around them. They lack concentration and therefore they get easily distracted by things, in the environment. Things, in classrooms, in the house, in the environment, they easily get derailed by those. Another thing, particularly, is that the child who is inattentive and also have some deficit in listening, they have difficulty following instructions in school. They are not able to particularly listen to what the teacher is saying. And because they are not listening and following instructions, it affects their ability to finish their tasks in classrooms or even at home. And like I said, sometimes some adults may also find that it's difficult for them to concentrate at work, to finish their tasks at work. If you are having a lot more challenges in this area than usual, you might also want to talk to your doctor about some of these symptoms that we are talking about. Now, it is not only, about classroom performance, but a child who lacks attention, will have some difficulty grasping and learning even like life skills and holding on to those life skills. And because they are lacking attention to details in their life, they are very sloppy. They make silly mistakes, milestone development that you feel that this child should be able to master, they are not able to master those because, again, they are not putting concentration into whatever they're doing. So their work looks very sloppy. They can hold a pencil right, they can write anything right, they can read right. They have challenges which spills into so many different aspects and areas of their lives. So if you have a kiddo who is struggling with paying attention, concentrating, or even trying to follow instructions, waiting for your turn, things like that, you might want to pay attention. The second predominant type is the hyperactive disorder. Children with hyperactive disorder, challenges finds a difficulty to sit still. Some parents say that it looks like the child is being run by a motor. It's go, 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 nonstop every day. And children who you have challenges in this category, also finds it difficult, to um, pay attention as well. So it's usually intertwined, which is a combination or combination of both. I'm going to talk about that a little later. They also find it, have difficulty sleeping, especially at night, because they become so active. Their sleeping patterns changes. They may sleep somewhat in the afternoon, and at night they cannot sleep, or it may change to where they are sleeping and then the whole day they can't sleep or cannot nap, and then at night there's a lot of activities going on in their brain, so they can't even shut their brain off to sleep. So if you have a child who is hyperactive than usual compared to their peers or compared to kids in their same age and category, then you might want to talk to a doctor. They can also be restless. It's like they touch things, they leave that, they go touch this one, they can't sit still, they're fidgeting a lot, they fidget with your fingers, touching their hair, playing with your hair, touching things around. If you are seeing more signs than usual, then it's important for you to talk to your child's doctor or a therapist to help you narrow down some of these symptoms. The sooner the child gets some structure and help, the better is it going to be for them, so that they can, be productive in their lives. Structure helps them to be productive. But if you're not paying attention and you kind of lump everything into the fact that it is normal childhood development, then you end up missing out a lot. Okay. Another thing that you want to pay attention to that is that when the child interrupts people a lot, they intrude, they cannot wait for their turn. These are all things, symptoms that you want to pay attention to. All right. The third category is a combination of both the inattentive deficit disorder and the hyperactive disorder. So, if a child has a combination of these two, this child is going to exhibit signs and symptoms of both of these two. They can lack attention to details, very sloppy work, they can't concentrate, and in the same time, they are hyperactive. They can't sit still, they're running around, they're restless, they're fidgeting, and they are having trouble sleeping. So if you see a combination of both symptoms in these two main categories that we talked about, then it means that the child has what we call ADHD. Attention deficit, some symptoms, and hyperactive disorder, some symptoms. So the combined is the ADHD. So if you have a child who is struggling more than usual, and you see some of these symptoms that we talked about, please don't hesitate. Talk to the doctor, find a therapist, put some structures in place. The solution is always not medication. In some severe cases, medication helps to take and tone down some of the hyperactiveness so that the child is able to concentrate. But in most cases, if structures are put in place on the get-go, the child is able to be conscious about their challenges and work together with a therapist or work together with an adult to kind of tone down some of the hyperactiveness and improve upon their concentration and attentive skills. Attentive skills is very important even as they grow, grow up in school, at home, at workplaces. If you are an adult and you find out that you are having more challenges finishing your tasks at work, paying attention to your work, and also that you become very easily distracted by things around you, this may be symptoms that were missed when you were young, and you want to pay attention to those as well. I want to say this. You also don't want to go about diagnosing every child with either ADD, hyperactive disorder, or ADHD. You want to critically observe the child, and that's because children naturally are active. If you have a child who is not active and they are very calm, sometimes some parents, have issues about that. But you want to recognize what is normal developmental characteristics of a child versus what is a little bit unusual. And that's what we're talking about. So don't go about diagnosing kids who are active as hyperactive. There's a difference. But if you have a child who is hyperactive and is exhibiting most of these symptoms, or all of these symptoms that we talked about, then please don't hesitate. There's help out there for you. Go get some help and help that kiddo settle down and be better. What we've noticed is that most of these kids are very intelligent. They are very smart. But because they're having the challenges of not paying attention, being hyperactive, can't sit still, fidgeting, and doing a whole lot, it interferes with your overall productivity in school and every aspect of your life. So please, if you have a child who is showing some of these symptoms, it's not too late. Or even if you're an adult, it's not too late. Please talk to a doctor, get help. In my subsequent video, I am going to be talking about some structures that as a parent you can put in place to help the kiddo, or even yourself as an adult if you're having challenges, some structures that you can put in place to help the child or to even help yourself to be productive in overall aspect of your life. All right, stay tuned and don't forget to subscribe if you have not done so that you don't miss any educative video coming out. Thank you, and you have a blessed day. Bye.